Good afternoon, everyone. We're going to get started. My name is Morgan Reining from the New England QIN-QIO, and I will be the moderator for today's webinar. Thank you for joining us for the second monthly webinar in the series for the New England Home Health Collaborative, Achieving Our Milestones. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded, and the presentation will be available a few days after the call, but you guys should have also received it in the email earlier today. I'll be providing details on accessing the recording at the end of this webinar. The phone lines are on mute for the duration of the presentation, and we will take all questions at the end, and I'll provide you with instructions on how to unmute your line at that time. Now to introduce today's speaker, Kathy Roby. Kathy is the Connecticut Home Health Lead for the New England Quality Innovation Network Quality Improvement Organization. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider clinical outcomes, and reducing acute care hospitalizations for Connecticut home care providers. Please welcome Kathy Roby.
Thank you, Morgan. Welcome, everyone, to this month's program. And aren't we all excited? We have sunshine, and they tell us it's going to be almost 60 by 3 o'clock this afternoon. So I promise you, I will be done before 3 o'clock, and we all need to step outside, take a deep breath of fresh air and sun, and remember that spring really will be here in 9 more days. So today, just so that we all remember, these programs are being brought to you each month by the New England Quality Innovation Network Quality Improvement Organization. CMS has restructured the QIO program, and so today this program is being shared with all 6 New England states, and Qualidigm here in Connecticut is in partnership with health-centric advisors, so that between the two of us, we can assist you in achieving your milestones in all 6 New England states. I'm going to start today, as I will every month, by welcoming those who have joined our Home Health Collaborative. They've signed their participation agreements since our last meeting on February 18th. So today we welcome from Connecticut, Middlesex Hospital Home Care, Orange VNA, Sterling Care Home Health, and VNA Northwest. We quite literally have covered all 4 corners of our state. My contact information is up there at the top, and if you have any questions, if you've not yet signed a participation agreement, please feel free to reach out to me because we really want you to be part of this project. In Massachusetts, we welcome Hallmark Health. And the 3 contact people for the Massachusetts agencies are listed here with their email addresses so that if you have not yet signed on, I hope you'll be doing so soon. In New Hampshire, we're welcoming St. Joseph Home Health Care. And for those who are not yet a member, Georgette and Leslie are waiting to hear from you. In Rhode Island, Brenda Jenkins is your contact person, Gail Colgan in Vermont, and Doreen in Maine. Today our topic is achieving our milestones. If you have been on the Home Health Quality Improvement website and clicked on the Cardio Land, you've seen these 5 milestones. No one expects any of the agencies to achieve all 5 milestones in the next couple of months. This is a project. This takes time. It's a learning and action network for a reason. So the first milestone is to go onto the website, join the Progressive Learning and Action Network for Cardiovascular Health, the Cardio Land. Once you've joined and registered your agency, you have achieved the first milestone. So that's a pretty exciting thing, and we do have a number of agencies who've already achieved that first milestone. Pretty exciting. And I'm very excited to say that we discovered yesterday that we have an agency that has achieved the second milestone. They've downloaded Cardiovascular Best Practice Intervention 1 and 2, and they have uploaded their first month of data. They've completed data access registration and started to enter patient information. Today's program is going to focus on how you go about registering your agency and collecting data. I especially wanted to do this program today because I need to reassure everyone that participating in this program, collecting the data, is absolutely not going to be a burdensome project. In fact, if we do it effectively and correctly, we can do this with minimal disruption and minimal time, which is very important because as home care providers, we know every agency is stretched to the max already. So our goal today is to talk a little bit about the best practice packages and about completing your data access registration. That will bring you to mile 2. And then as we go forward, we'll talk today about how you put your data in and how you would upload it going forward. So, that first milestone, if you're not yet registered, there's the web link, www.homehealthquality.org. On the home page, you're going to the registration tab. Complete all of the fields, and one of the fields you need to identify is who will be your agency champion, the contact person. I strongly urge that you also designate a backup person because even an agency champion has to get a day off once in a while. Not too many, but a once in a while doesn't hurt. Once you've done that and gotten registered, please explore the site. There are tremendous resources available to you. This is the home page. And so you're going to see in the banner across the top, right under the header, you have separate tabs. The second from the right says registration. That's where you're going to go to register your agency, because you will not be able to access all the wonderful resources in this website until you've registered your agency, set up your password, so that you can then come back, go to the far upper right corner, and log in. The cardiovascular health is right there in the center. Once you go there, you'll be able to click on that tab and register for the LAN. But the first step is to register on the website. Now about the LAN, under cardiovascular health, when you click on that first tab, you'll see a long drop-down. Right in the middle it says Cardio LAN, so you click on it. If you choose to, you can actually enter this web link into your favorites. When you get to the cardiovascular LAN site, you're going to see a large blue button on the left, and that will help you to complete the registration of your agency. When you get there, you'll be able to look at the quality measures that are included as part of the Cardio LAN package. There are 6, and we call those the cardiovascular ABCs. We'll talk about exactly what they are, so that you'll be able to make an educated decision about which one is most appropriate for your agency. I keep reinforcing that you only need to select 1, maybe 2 if you're feeling ambitious. And remember, when you hear that rumor that's out there that collecting the data every month will take a minimum of 4 hours and maybe longer, that's only based upon your deciding to collect data on a maximum of 12 patients for all 6 measures. But you don't need to do that. We believe that your data collection, if you select 1 measure, is only going to take you a maximum of up to 2 hours, and most likely will take less. So if you've registered your agency with HHQI and you have registered on the cardiovascular LAN, you've just achieved milestone number 1. Congratulations. But what comes next? When you're in home health, we're used to this, right? There's always a next step. Milestone 2. I promise you, it doesn't look like that cloverleaf. It's much easier to get there from here. Now you're on the network. You are looking at cardiovascular health right there in the middle. You've clicked on Cardiovascular Land, you've gotten yourself registered. What comes next? You need to click on the Data tab, because this is where you're going to go in and register yourself, get a user ID and password all set up so that you'll be able to enter data. Once you've clicked on that Data tab, this is the screen you're going to see. It says, Welcome to the HHQI National Campaign Data Access System. The first of the two boxes says, Register here if you are a first-time user. It's a separate registration from the one you've already established as being your agency's registration on HHQI. This is specific for the data. It's important that your agency champion, the agency backup, and whoever's going to enter the data all have access to this user ID and password. If you've already gone on and set this up, once you come back to work in the site to perhaps abstract and enter data, you would click on the second box, and this is going to help you to then move on and move forward. Before we do that, let's take a look at what else is on the page. On the right, it says Data Report Resources. There are step-by-step manuals here and webinars that will help you to understand exactly how to go through the process. They are not long. They average 15 to 17 minutes. They're easy to listen to. I have actually listened to just about all of them and read through the FAQs. They are very, very helpful, and you will find that they will assist you in working in the system. So we've talked about these two boxes now, talked about the data resources on the right-hand side. Once you have gotten your password and your user ID, and you've logged in, this is the first screen you're going to see. It's obviously not July anymore. If you were to click in here today, what you would see is, please select what area you would like to review for the month of February. The data you're abstracting, if you do it today, is February discharges. Now you see below the ABCs: aspirin, blood pressure, cholesterol, and smoking, ABCs. This is where you decide which of the measures you are going to be pursuing, at least in the beginning, until you become more facile with the site, until you have a better feel for how much time this is going to take and how you work within the site. I really would urge you to select either aspirin or tobacco use as your measures that you're going to work on. So you would simply click one of those items, pick one of the four. You really don't need to select all four. Once you've picked one, this is the one you're going to use for this month. Once you've selected it, you're going to go to the right-hand side and save your settings. You see it there on the right where the yellow arrow is pointing. So now you've saved it, and here you are looking at the month of discharge. As I said, if we do this today, you're going to be getting on your screen, the year will be 2015, month of discharge will be February. Once you've done that, you're going to click on the Abstract button immediately to the right of the month. Once you do that, this is going to show you the charts, the discharged patients that have met the criteria for that particular selection. If you are screening aspirin usage, anticoagulants, if you're screening smoking cessation to see how you are doing in getting your patients to follow through on their use of aspirin or their anticoagulant, whatever it is, or if you are being successful in screening and educating for smoking cessation, if you've selected one of those, when you hit abstract, the only records that will appear on the screen are those records that apply to that selected measure. If you went through on the website and you were to actually look at the information under, let's say, tobacco cessation, smoking cessation, for that measure, what you would see at the bottom of that handout is a list of ICD-9 codes. You'll notice that these codes all relate to respiratory illnesses. So if you selected tobacco user as your measure that you're studying for this month, and you have been working with your staff so that they are distributing smoking cessation materials with every admission and inserting into the chart on admission the measure and the question, one or two questions is all there are for tobacco cessation. If you've been inserting that into the admission record, now when you hit abstract, you're going to get a list of only those discharges whose primary diagnosis is relevant to smoking cessation. So now we've talked about what selection did you pick, and now what happens is you're looking at the headers on the columns. The CCN, your patient ID, the start of care date, the discharge date. So what happens now is, obviously we can't show you patient data, but what you would have seen is a list of only those discharges that are relevant to tobacco cessation. If you only had 5 discharges that were relevant, you'd only see 5 patient names. If you had 25, you're only going to see the ones that are relevant. The maximum data abstraction they would like you to have is 12. If you only had 4 or 5, that's all you need to do. In order to abstract the data, you're going to select the patient and click on Edit. If you were following aspirin, anticoagulation, the first thing that will happen when you selected a patient and clicked on Edit is here's the question. Did the patient take aspirin or other antithrombotic medications during this episode? Because you only need to answer the question about those patients, especially if you have an electronic record, it will be very simple for you to get this information. But the way to save the most time and to make this the easiest possible task is that you have put the piece of paper from the HHQI website that is specific to this measure and placed it in the patient's record on admission, if this is, in fact, the measure you're going to be studying. So when your nurse discharged the patient, she has the record right in front of her, she can simply answer the question at that time and then turn in the form once her discharge oasis is done. Now when you or the designated data entry person, because this does not require a clinician, if they do not have to look in the chart, if the nurse has simply turned in the form at time of discharge, then the person doing data entry will not be needing any clinical background. They can simply go in, take the piece of paper, click on that patient, answer this question, and keep going. If it's blood pressure control, the nurse will have entered it on the form and turned in the form, and then you simply enter this data. We have one question for anticoagulants. We have this one for blood pressures, and you're entering in those 3 pieces of data and answering the question. Right there. There is a text box on each of these different measures, if in fact you need to add additional information. If you don't need any information, then you simply click the Save button, and you are done with that record. If you needed to look something else up in the file, or if you had a question about this record that you needed to discuss with the nurse, you could simply close without saving and move on to the next patient. When you have completed editing in the information from all the records that you've looked at that apply to the measure you selected, Remember, if you selected aspirin and it only shows 4 or 5 records, that is all you need to do. Once you've entered the data for all the ones that show there, up to 12, you then close out the month by clicking on that button. And guess what? You have now achieved milestone number 2. But then again, we're in home care, so there's always something else. What comes next? Wouldn't you like to see your data? You will be able to get your reports by going to that section of the website, entering your login will print out who the agency is and who the contact person is, and then you'll use this drop-down in order to look at your reports by clicking on Get Reports. You see HHCDR at the top. This is how you get to this page, Home Health Cardiovascular Data Registry. Here are the data abstraction tools. This can be done as a 2-sided form. You can place this, as I said, into the record at the time of intake, right there with the consent forms. The general patient information, all you need is the patient ID for MU020, your start of care date, and then answer whether this patient has both a Medicare and a Medicaid number in the file. Having done that, you advise your clinical staff as to what measure you are studying. It's best if you select one and continue with it for at least 2 or 3 months before moving on to another. And as I suggested to you, I would urge that you use either aspirin, blood pressure, or smoking cessation to start with. The cholesterol management will require you to get laboratory data, and that's most likely going to involve trying to chase it down from the physician's office. So I do think that in the interest of saving time and keeping our stress levels low, I would suggest you start with either aspirin, blood pressure, or smoking. Now about the BPIPs. Let's go back there for a moment. We talked about them last month. The BPIP stands for Best Practice Intervention Package. And we really want to use consistent messaging, consistent tools, and we truly want to reach out to our disparate populations, which is why all the patient education materials are in both Spanish and English. So cardiovascular health, number 1, focuses on the use of anticoagulants and blood pressure control. Number 2 focuses on cholesterol management and smoking cessation. Now I know, I ran my own agency for a number of years. I've been in this business a long time. I know you are busy. Every day needs at least 30 hours in it for you to even keep up, let alone get ahead. How can you use these tools and participate in this program effectively without overwhelming both you and your staff? Number 1, select only 1 or 2 of the 6 measures to work on. Identify the section of the best practice package that relates to that measure only. Identify in the package the staff and education materials that are for that measure. A targeted, limited approach decreases the stress on both you and your staff. I seem to be picking on tobacco cessation today. Measure 226 involves screening for tobacco use and encouraging cessation with appropriate interventions if it's identified. Staff training in the BPIP package number 2 includes 4 pages of pre-done, recommended clinical education for nursing and therapists. There's a separate set of education for your home health aide staff. There's a 20-minute podcast that is geared to all levels of your staff. There's a sample bulletin board in case you have someone who really likes to build those kinds of things. The patient education is truly amazing. It's in English and Spanish, and it's very, very useful. In the package, for smoking screening and cessation, there is an evidence-based 5-step process that focuses on the behavioral and the psychosocial aspects of those who are active smokers and how we can help them to come to the point where they are ready and able to take that step behaviorally, emotionally, intellectually, and socially to say, I want to be a non-smoker. One of the most important things we can do in any one of the measures and interventions we take is that we are always going to want to focus and frame what we do in the positive. In the positive, I want to be a non-smoker. The negative side, I gotta quit. Quitting's negative. It looks hard. It looks nasty. They're going to miss it. They want it. I'm going to eat too much. I'm going to get fat. I won't have anything to do with my friends. I won't know what to say if I'm not smoking. I know. I was a smoker. I quit 20 years ago. Even though it was 20 years ago, with the right glass of wine, my finger itches. But I wanted to be a non-smoker, and I am. So we focus on all the behavioral things that go with it. And this 5-step process that you will find in the best practice package is wonderful. It absolutely focuses on all the right words and the right steps to help you help your patients. How do you make the data collection easier? As I said, if this is the tool if this is the measure you selected, include the smoking cessation literature and the self-screening tool on every admission package. Insert the data collection tool in that component of the chart that is still paper, the advised consent, the referral information, attach it right to it. The admitting clinician should enter in the patient's name, Medicare number, answer that question about whether or not they're duly eligible on admission. The actual question, or two I think there are, with smoking cessation, is collected on discharge. So just leave that tool in the record until you discharge the file. Assign a central location, train a data entry person in how to do the data collection on HHCDR, and you're all set to go. Very simple, very easy, and very time and cost effective. So remember last month we talked about Million Hearts? The Million Hearts campaign is hoping that you will support smoking cessation as an agency. How can you do that? You can do that by purchasing from the CDC the free no smoking area signs. Post them everywhere that you possibly can. If you own your building, post them literally everywhere. Every bathroom, exit doors, entry doors, any place you can think of, especially where everybody gathers for lunch. If you're a tenant, get permission of your landlord to get them up there. You want a non-smoking campus. As a health-related facility, you really want a 20-foot no-smoking zone around the building if you can possibly get your landlord to agree to help you. As an entity, as a business agency, as a healthcare provider, we should all be supporting with our employees cessation aids. So if your company offers flexible spending, make sure that Nicorette, any kind of smoking cessation aid is available to them as an employee benefit. And this brings us to the part of our program this month where we do peer-to-peer sharing. I know we shared our email addresses last month. I haven't received any emails, so I don't know if anyone on the line with us today has anything that they would like to share. We are hoping that as we go forward, continuing to have these webinars each month, that we will be able to speak to one another. If you are currently doing some kind of a program in your agency, something you're using to improve the outcome of care that might relate to anticoagulants, to hypertension. Under hypertension, do you have diet education, tools? Are you using the DASH diet with your cardiac patients and your hypertensive? We need to share with one another, because by doing that, we can achieve our goal to improve the outcome of care. When I first came into home care, we always shared with one another. We tried to respect our boundaries geographically. We all wanted our fair share of the market, but we did reach out more, much more than we do today. I'm hoping we can bring that back by allowing 5 or 10 minutes every month to share what works and ask for help if you're struggling with something. So what I'd like to do is to open the line, and Morgan is going to tell you how you can unmute your line and ask a question.
So if you have any questions, please press *6 on your phone to unmute your line.
Once you've done that, please feel free to ask any questions that you might have. Oh, I don't hear anyone. I don't seem to have any questions today. I do want to remind everyone that next week, on Thursday, Home Health Quality Improvement, on their website, they have an educational webinar being offered, and it is related to this project. If you've not yet registered for the webinar next Thursday, March 19th at 2 p.m., please go to HHQI and get registered today. While you're on the website, take a quick look through their archived webinars. You're going to find that there are several on there that will be of interest to you. I hope that you will find something you can use. They make a terrific resource for providing your staff with a monthly in-service project. We know that we have to offer in-service to our staff every month. We need to give them 12 hours a year. This is required of us. By using the HHQI website resources, you're going to be able to, again, reduce some of your own internal costs. By doing that, you will then free up a little time on the part of your staff educator or your quality manager, or maybe even the clinical supervisor who's been tasked with that project. They will be able to free up a little time to spend some time looking at the website, perhaps collecting the data, training the person who's going to input the data. But we can help you with this. We've given you the contact information for each state. Please reach out to us. We will try to send out a summary of the project and the participation agreements again to those who have not yet signed up. We truly want to work with you, and we hope to hear from every one of you very soon. If you need assistance, you're already registered, you've signed your participation agreement, but you're having difficulty with the data registry, I know here in Connecticut we've had calls from 2 agencies, and we've been able to help them get all set up so they can begin to collect data. If you have difficulty, once you've registered on the website, if you're struggling with the data registry, what you need to do is go to this PowerPoint, find the contact person, the home health person for your state, send them an email, they will give you a call and walk you through the process. If we are still having a difficulty that we can't help you with, we have a contact at HHQI, and she will help us fix it right away. So please give us a call, email us. We're happy to reach out and help you. Again, if anyone has a question, we'll give it a couple of minutes. And if not, enjoy the sunshine, everyone.
So if there are any last-minute questions, please press *6 on your phone to unmute your line. All right, I guess there's no questions today, so thank you guys for joining. Just a few last-minute announcements. In the next few days, we will send out an email to everyone that contains the presentation and recording of this webinar. And then thanks again, and have a great day.